Imagine spending hours every week hooked up to a machine that keeps you alive. Today, we delve into the world of hemodialysis patient. Good day, everyone. I am Ronalyn Blancia, together with Samantha Azarcon, Lalaine Beler, Philippe, Britania, and Darweena Cacho. We are here to present our research entitled Life Online, Unveiling the Lived Experiences of Hemodialysis Patients.
So the purpose of the study was to explore the lived experiences of hemodialysis patients in Bacolod City.
For the research design, descriptive phenomenology was used to explore people's lived experiences and uncover deeper insights into their actions and motives. In-depth interviews, essential for extracting detailed and nuanced contextual information, enabled researchers to understand the unique experiences and perceptions of the participants.
Next, for the sample study, 8 participants were chosen with the following criteria. Must be residing within Bacolod City, must be within the age group of young adults, middle-aged, and older adults, specifically 18 to 65 years old, either male or female, and must have undergone hemodialysis for over 6 months.
We now go to the instrument. The main tool used for gathering data was an interview guide covering both socio-demographic details of participants and their experiences with dialysis. This guide contained a primary questions about your hemodialysis experience translated into Hiligaynon, as well as additional questions exploring the advantages and disadvantages of dialysis and how they cope, all reviewed by guidance counselor. We now go to the results discussion of the study. For theme 1, we have here Foundations of Resilience Nurturing Support System. Delves into the vital role of support networks for hemodialysis patients. This theme, backed by research from Kim et al. Of 2018, emphasizes the significance of family, friends, and healthcare providers in bolstering patients' well-being, treatment adherence, and overall quality of life. Drawing from Catherine Kulkaba's theory of comfort, it underscores how these support systems are integral to patient experiences and outcomes in hemodialysis care. Family support emerges as a cornerstone in assisting hemodialysis patients, with examples illustrating how siblings offer both financial aid and emotional solace, underscoring the importance of familial ties in navigating treatment challenges. Likewise, friendship fosters a sense of community and reciprocal assistance, showcasing the value of social connection in coping with chronic illness. Moreover, healthcare professionals plays a vital role by providing expertise, guidance, and emotional support, underscoring the importance of compassionate and competent medical care in fostering patients' resilience during hemodialysis treatment. We now go to the theme 2, Adaptive Arsenals Unveiling Coping Mechanism. Delves into how dialysis patients employ coping mechanism to manage their condition, exploring emotional, practical, and existential strategies. Sub-themes include emotional coping, practical management, and finding meaning, with research supporting the importance of adaptive coping for quality of life. Understanding this mechanism enables healthcare providers to offer targeted support, enhancing patients' well-being and treatment outcomes. In terms of emotional coping, patients emphasize the importance of maintaining a positive mindset and accepting their situation, recognizing that positivity and acceptance are essential for enjoying life despite the challenges of dialysis. On the practical side, patients prioritize the well-being of their family, finding solace in the success and independence of their children, allowing them to face their condition with peace and preparedness for the future.
The third major theme of the study is reflection of identity navigating self-perception. The respondents have common answers in the sub-themes, which is first, embracing resilience as identity. The unpleasant experiences so far haven't been that bad because I'm really aware of my food intake and I'm also mindful of my water intake, and I don't disagree with my doctor's suggestion. I just follow them. Next sub-theme is confronting hardship and self-perception. Yes, so I realized and accepted that there are no more regrets because the more you regret, the harder it is to move on. So you just accept the realities in order to move on. That's why you should always stay positive because you're the only one stressing yourself out if you keep blaming yourself. So just enjoy life, enjoy normal life. I don't care anymore. The third sub-theme is courageous reflection of patients embracing self-acceptance. Think always positive and learn to accept the realities of your life as a dialysis patient because you don't have a choice. So the best thing is to accept the realities as your life. Then always think positive, go with your life, enjoy your life. That's just how simple it is. The last major theme of this study is riding the rapids, hemodialysis patients confronting challenges. In the first subtheme, which is transforming tides in lifestyle and well-being of hemodialysis patients, the respondents have a common answer. I don't eat noodles, fruits, milkfish, tilapia, crabs, and shrimps. Those are what's prohibited for me, along with coconut milk. I've completely stopped eating what's prohibited for me. The next subtheme is financial burden of hemodialysis challenges. To be honest, as a dialysis patient, it's really exhausting, especially mentally, and the top challenge is money. Because the medicine we use every session, I have to buy it because I'm too lazy to wait in line to ask at the charity center. The last subtheme is soul strain and mental health challenges of hemodialysis patients. Think always positive and learn to accept the realities of your life as a dialysis patient because you don't have a choice. So the best thing is to accept those realities as your life, then always think positive, go with your life, enjoy life. That's just how simple it is. In the conclusion of the study, a symbolic representation was made for the hemodialysis patients, the respondents, which are likened to being as resilient as bamboo, which yields but does not break under stress. This represents their ability to adjust and persevere in the face of the material, psychological, and bodily costs associated with their illness. Patients show incredible development potential and perseverance in the face of adversity, much like bamboo, which can flourish in a variety of settings.
For the conclusion, the study highlighted the critical role of strong support networks and comprehensive patient-centered care for hemodialysis patients, addressing social, psychological, and financial challenges through holistic treatment plans. Patients develop coping mechanisms like problem-solving, positive reframing, and spiritual practices to manage emotional distress and adapt to their condition. The study calls for policymakers and healthcare providers to prioritize comprehensive care, including financial assistance, mental health services, and public awareness campaigns, while also encouraging future research on patient experiences and supporting interventions to improve quality of life.
As for the recommendations, first is the health officials and policymakers. They must prioritize comprehensive support systems for hemodialysis patients, including financial assistance and mental health services, alongside creating accessible healthcare policies addressing medical and psychological needs, as well as increasing awareness campaigns about kidney health challenges. Next is for healthcare providers. They should adopt a patient-centered approach in hemodialysis care, focusing on addressing physical, emotional, and psychological needs through enhanced communication skills, empathy, and regular assessments of patient satisfaction. Next are nursing students. They should actively engage in clinical rotations in hemodialysis units to gain practical experience and exposure to the unique needs of dialysis patients. And lastly, for the future researchers, the study was conducted solely on different dialysis centers, and the researchers recommend for further studies regarding the lived experiences of hemodialysis patients.